Well, welcome everybody. Welcome back to Thrive in Your Body with Homeopathy series, where we discuss what homeopathy can do for you and your loved ones, especially if you're suffering from a chronic condition. So today I am very much looking forward to our very esteemed and distinguished guest, Dr. Kim Elia. And before we bring him on the screen here, let me introduce you to him. Let me tell you just a little bit about who he is. So Dr. Elia was inspired to study homeopathy when he read Mahatma Gandhi's quote, "Homeopathy cures a greater percentage of cases than any other method of treatment." Homeopathy is the latest and most refined method of treating patients economically and non-violently. So Dr. Kim Elia, inspired by this quote, he has been studying homeopathy since 1987 and graduated from the New England School of Homeopathy. Kim serves as CEO of and the co-founder of Whole Health Now, and he has been instrumental in the creation of Whole Health Now's website, a comprehensive free informational resource for students and professionals. He was also inspired to create the Holistic Homeopathy Timeline and is responsible for growing a library of recorded interviews and presentations with today's world-renowned homeopaths on a variety of timely and relevant subjects. So students from all around the world have expressed appreciation and admiration for Kim's superb knowledge of the history of homeopathy, his deep understanding of homeopathic prescribing, and his extensive knowledge of materia medica. So Dr. Elia was as well the principal instructor and developer of the 4-year classical homeopathy program and at the Hahnemann Institute or Hahnemann Academy, in Tokyo, Osaka, Japan. And Osaka, Japan. He was also instrumental in the development of the online web application for homeopathic first aid and acute care, Homeopathic House Call. He has served as director and principal creative lead on a feature-length documentary about homeopathy, Introducing Homeopathy, which was completed in April 2024, I believe, and it was premiered at the Joint American Homeopathic Conference in Virginia. So, well, this is so impressive and so excited to have Dr. Elia here on the show with us. Welcome, Dr. Elia. Thank you so much for joining us. I cannot wait to hear from you.
Thank you, Monica. Thank you for inviting me.
Of course, of course. So today's presentation is going to be just a little different than our previous interviews because Dr. Elia was so gracious to want to share with us a couple of case studies from his treatment room, I believe. So there are 2 cases, and let me just sort of introduce our audience. If you can tell us, Dr. Elia, a little bit about why you chose those cases, what are the cases about, and if there's anything special about them.
Sure. Well, you asked me to present a case on acute care and chronic. So I'm going to show 2 cases. One is a case that I presented at the Czech Summer School in the Czech Republic a few years back. It was a case of impetigo, and I'll show you that particular case. And then I've got a chronic case of a young girl who I was working with when I was teaching in Japan, who had a condition called atrial septal defect and non-classical mitral valve prolapse. Essentially, that means she's got a hole in her heart. So the reason I selected those 2 cases is because the response to the remedies is quite dramatic, and it really demonstrates what homeopathy is capable of doing in terms of affecting people's overall state of health.
Fantastic. And so because we have those 2 cases today, can you tell us more about the differences between treating acute and chronic conditions with homeopathy?
Well, I would actually categorize diseases into 3 different possibilities, which would be a real acute, a chronic, and what is referred to as an acute exacerbation of your chronic state. A real acute is like when influenza or malaria comes into your area and most of the people or many of the people in that particular location contract that disease. That's a real acute. Or you get the common cold or COVID-19. Those are real acutes. And that's in contrast to a chronic condition, which is a condition which you are not able to overcome. It either kills you or you persist with that disease indefinitely for an extended period of time. An acute exacerbation of your chronic state is a situation where normally you're in a particular situation and your health is doing fairly well, and then you're exposed to a particular stress, and because of that stress, your system weakens and you develop an acute bronchitis or acute pneumonia or an acute asthma attack. Those are not real acutes. They're acutes that are based on your constitutional makeup. So when we're giving homeopathic remedies, we think of giving remedies for acute conditions, for chronic conditions, and for the acute exacerbation of the person's chronic state. In terms of treatment, acutes in general are much easier to deal with. We actually developed, as you mentioned, a online web application called Homeopathic House Call, which assists the general public to find first aid and acute care remedies for simple complaints. And that's fine for the general public, moms, people working out of their homes, totally okay to address, non-serious acute and first aid types of situations. But when you're dealing with chronic disease, you really need to be working with somebody who is well trained. There are a lot of challenges involved in dealing with chronic disease. Of course, homeopathy can produce wonderful results, but you do need to be very, very well trained to be able to unravel a complex case of chronic health problems.
Okay, yeah, thank you so much for mentioning that. That's very important to know that, we never promote or encourage anybody to treat their chronic condition with homeopathy on their own. It's a very important thing to remember. So the other thing, as we're talking about chronic conditions, since we're going to talk about a chronic heart condition, tell us how does it work when homeopathy comes into picture? Is it still possible? Is it still a good idea? Or can we still work with a conventional medical doctor?
So, yeah, homeopathy definitely can be used in conjunction with conventional medicine, especially what conventional medicine has to offer in terms of heroic interventions, surgery, you get hit by a car, you have some type of physical obstruction in the body that needs some type of intervention. Those types of technologies that conventional medicine offers are invaluable. And homeopathy can complement those really, really well. So there are many medical physicians out there who are using both conventional medical approaches in conjunction with homeopathic treatment and are getting very, very good results. One person, for example, is Dr. George Yurge in Romania, who's a medical doctor, and he uses both conventional and homeopathic approaches with his patients.
Okay, wonderful. Okay, so unless there's anything that you would like to add to this, let's jump into the presentations.
Sure. Okay. So as I mentioned, I'm going to present two cases. Now, the first case here was one that came about when I was instructing at the Czech summer school. It's basically 8 days of straight teaching in this beautiful country. You can see the countryside there. It's very, very, very lovely. And I was asked to teach on 3 different topics. They asked me to speak on the homeopathic treatment of asthma, the use of bowel nosodes in homeopathic practice. Bowel nosodes are remedies that are prepared from bacteria that is in the large intestine. It was discovered by various individuals that when you gave a homeopathic remedy, that there would be certain types of bacteria that would be discharged from the body. These bacteria were associated with those remedies, and we use these particular remedies to work when the well-selected remedy in homeopathy is not acting. It can help to unblock the case. So I was asked to speak about bowel nosodes, the homeopathic treatment of asthma, and finally, a very old repertory that was published in 1846 called the Bönninghausen Therapeutic Pocketbook Repertory. And I started on this particular topic, and there were maybe about a couple hundred people in the audience, and I could see from the faces of the people in the audience that they were not happy. They were thinking, why is this guy talking about a book from 1846? We want to know about new remedies and new ideas in homeopathy. We don't want to hear about some book that was published more than 150 years ago. We're not interested in that. Now, I know the value of the Bönninghausen Therapeutic Pocketbook Repertory, so I persisted. And on the second morning, I began to discuss what are called one-sided cases. One-sided cases are cases where there aren't a lot of symptoms and it makes it much more difficult to find the appropriate remedy. But I was showing that you could still use the therapeutic pocketbook repertory to resolve these types of cases. And during the lunch break on the second day, this woman came up to me. She was a student of homeopathy. She'd been actually practicing homeopathy for over 20 years. And she said, Mr. Elia, Dr. Elia, your presentation is very interesting. My daughter has impetigo. It's very serious. I've given her 6 or 7 different remedies. None have had any effect whatsoever. Can you help? And I said, well, let's just do the case in front of the class after lunch. I'll put up the picture of the girl. We'll use the Burning House and Therapeutic Pocketbook Repertory to find a good remedy for the case. And I'll show you how this repertory works. And she said, thank you very, very much. Here's a picture of her daughter, 12-year-old girl. And you can see that she has this very, very, very excessive impetigo on the left side of her face. It's actually quite a bit worse than what you see here because there's actually a salve that's sitting on top of it. It's actually ulcerated in the center, and there are blisters around the ulceration. And it's not only covering a large part of the left side of her face, it's aggressively spreading from the left side of her face to the right side. So this is very aggressively spreading bacterial infection.
And
She had
Dr.
given
I'm sorry, can I interrupt you for just a second? Can you tell our listeners who maybe not doctors or homeopaths, just very briefly, what is impetigo?
It's a bacterial infection of the skin.
Okay,
Yeah.
great.
So so basically she had given a number of remedies. She had given sulfur and I think mesurium and tuberculin and bacillin, but none of them had had any effect whatsoever. And this really was a kind of a one-sided case because there weren't a lot of symptoms. Really, the only symptoms in the case were that the impetigo was ulcerated in the center with blisters right around the ulceration. It was worse at night. It was worse opening the mouth, but if you look at this, you'd be surprised that it wasn't worse opening the mouth. The symptoms in homeopathy that generally tend to be most useful are the ones that are peculiar, that you wouldn't expect, that are strange and striking. So, for example, if you had a burning pain that was better from heat, that would be unusual. That type of a symptom would be particularly useful for us in homeopathic practice. So the fact that it's worse opening the mouth, again, if you look at this, it'd be surprising if it wasn't worse opening the mouth. It was also worse with touch, but again, the same thing. You'd be surprised if it wasn't worse with touch. So these aren't particularly strong symptoms. And then the final symptom of the case was that she had a sensation as if there were crawling insects underneath the impetigo. And that's it. Now, I can tell you that if you take these symptoms and you convert them into rubrics. Rubrics are a rubric is a symptom in a book called a repertory that lists the symptom with all the remedies that potentially could produce that particular symptom. And what we do in homeopathy is we take these, what are called rubrics, these symptoms, and we say, okay, the patient has abdominal pain, better from pressure, and they have a head pain that's better from open air. And we take all of those symptoms and we see which remedy covers all of those symptoms by crossing those various rubrics against each other. Now, if you do that in a more contemporary repertory like the complete repertory or synthesis or any of the post-Kentian type of repertories, you're going to get a lot of remedies because these rubrics are very large in these more contemporary repertories. But the Burning House and Therapeutic Pocketbook Repertory, which was published in 1846, has a much smaller number of remedies. And consequently, when you do the repertorization using this particular repertory, only one remedy comes up. The remedy that came up was the remedy called Mercurius. I went and opened up Hahnemann's chronic diseases, and I showed them that, yes, Mercurius was a good selection for this particular case based on the symptom match. I suggested to the woman that she give her a dose of 30C in solution, succussing between each of the doses. This is an important consideration in homeopathy. It's something that Samuel Hahnemann, the founder of homeopathy, introduced into the 5th edition of the Organon, which is that you needed to change the potency between each dose. The way that you do that is by putting the remedy in solution and what we call succussing it or shaking it between each of the various doses. So she didn't happen to have a 30C potency available. She only had an 18C. I said, no problem. Start with the 18C and go and get the 30C, and we'll switch over once you've gotten it. With the very first dose of 18C, immediately this aggressive impetigo that had been spreading from the left side of her face to the right just stopped spreading. It just simply stopped completely. Later in the day, she acquired the 30C, which she was taking, every like 45 minutes to an hour in solution, succussing between each of the doses, shaking between each of the doses. And in 60 hours, so that's basically 2.5 days, 60 hours, she went from looking like this, to this.
Wow.
So
Yeah.
from this to 2.5 days, she went from this to this. Now, this may be the most remarkable response that I've ever seen with a homeopathic remedy, because theoretically your skin should not be able to heal in 2.5 days when it looks like that. Of course, she's very young. Her life force is strong. Her immune system is good. She's able to heal more quickly than maybe somebody who was older might. But still, even that, this is remarkable. And it demonstrates the power of homeopathy and the value of the therapeutic pocketbook repertoire. As a matter of fact, after I demonstrated this case, all these people who were looking at me very skeptically about using this book from 1846 immediately went out and purchased a copy of that particular book. So it was a great case. I was able to show it right in front of a group of people, 200 people in the audience, and they all got to witness the power and miracle that homeopathy can offer to people. So that's the acute case that I wanted to demonstrate.
Mm-hmm. Lovely. If I just wanted to summarize a couple of things, because that you said are very important for our viewers. That often we are not looking like your medical doctor will look for the most common symptoms that you are showing. Homeopathy will often look at what is actually peculiar, what is strange, that she actually didn't have pain when she was opening the mouth, even though we were expecting that. So if you go to a homeopath for the first time, you may actually be kind of surprised about those things. So I just
You do
wanted.
have to, when you're practicing homeopathy, you have to think about things very differently. We don't. There's a word called pathognomonic. The pathognomonic symptom. Uh, the old definition of a pathognomonic symptom was one which would be the common symptoms of that disease. Today, it's used to identify the symptom which helps you to diagnose that particular condition. So, for example, if you had rice water stools, that symptom would point to you having cholera. That would be the pathognomonic symptom for cholera. But in general, pathognomonic symptoms are the common symptoms of the disease. It's not to say that we ignore those symptoms, we don't, but they're not particularly useful in helping us to narrow down our remedy choices, because so many remedies have those symptoms that they don't help us to narrow down or differentiate from one remedy to another. Whereas if you have a very peculiar symptom, he coughs when he plays the piano, there aren't a lot of remedies that have that particular symptom, and consequently it helps you to narrow down your remedy choices more easily. So yes, these strange, rare, and peculiar symptoms that Hahnemann describes in aphorism 153 of the Organon are essential to being able to practice homeopathy successfully.
Wonderful. Okay.
All right, so the next case that I'm going to present here is a case of atrial septal defect. It's a case of a little girl. You can see a picture of her here that I was working with in Japan. As Monica mentioned to you, I ran a 4-year homeopathy program in Tokyo and Osaka. I'm going to go ahead and read through the case here, and let's work together on this. I don't know if people can type in or provide suggestions. Can they do that?
I'm not sure at this time there will be a lot of people who actually can provide, who can provide
Okay,
suggestions.
well, anyway, I'm going to ask you then.
Let's
Okay?
see what happens. Yeah.
Okay. So I'm
Okay.
going to read through the case, and this is what I would do with my students. I would read through the case, and I would ask them to identify what they feel is most important in this
Oh,
case.
awesome.
That's really the key to homeopathic practice. And again, I want to emphasize that what is strange, rare, and peculiar has particular value because it helps us to narrow down our remedy choices. So this is a case of atrial septal defect. C is an 11-month baby girl who's been diagnosed with atrial septal defect, a hole in her heart, and non-classical mitral valve prolapse. So she's got a prolapse in her mitral valve. In addition, C was born with an enlarged liver and extensive skin eruptions, which are dry and itch continuously. Let me show you what those look like. So here's the little girl, and here you can see the skin eruptions on the back. They kind of scale up, and then they'll erupt, and they'll weep, and then she'll itch them, and then they'll bleed and weep. And you can see they'll scale up on her back. A lot of them are found in the folds of her skin. So here you can see in her ankles, okay? So all over her body, okay? All right. Um, C's mother's sister had died at the age of 2 from a similar condition. The symptoms were as follows. Of the cardiovascular symptoms, the chief complaints were audible palpitations, which were aggravated from any type of excitement or exertion. In addition to the palpitations, there was also accelerated respiration, also aggravated by excitement and exertion. The palpitations were quite violent and audible from a close distance. In addition, uh, C had difficulty sleeping as the eruptions would cause her to itch and keep her awake. In general, C had never been able to sleep through the night, always being rather restless. After scratching, the eruptions would weep and bleed. The eruptions had also been worse during winter. I saw C at the beginning of May, and even though she still had the skin eruptions, they were not as bad or as itchy as they had been during the winter. C's feet tended to be cold, and she perspired on her upper arms only. The perspiration looked like big beads or drops of water. She seemed like your normal, shy Japanese baby, and the parents said she was basically a fairly happy little girl. She did seem to be affected by any type of excitement, and this could make her hyper and overstimulated, after which she would usually fall asleep. C could also get startled from loud noises. So that's the summary of the case. Monica, what stands out to you as being of importance? What would you say here that you would focus on? What do you think? What's unusual in this case, or what's striking? What would you not expect to see? And I don't know if anybody else is on who could offer suggestions. Monica, you still with me?
Oh, I'm sorry. You know what? My microphone misfunctioned. I was just talking. I apologize. So, yeah, I was interested. Well, the heart problem together with the rush was interesting. And just the very detailed description of her, um, the cold drops, let's see, like big beads or drops of water, which seems
Yeah,
like,
I agree. You know, that perspiration on the upper arms, like if you asked a group of people, do they perspire? Pretty much everybody would raise their hands, right? And if you ask them, do you perspire under your arms? You know, like 95% would raise their
Mhm.
hands. Do you perspire on your head? And, 20% would just raise their hands. And you perspire on your feet, 15%. So I don't know, just guessing. But if you said, how many people in this room only perspire on your upper arms? No one would raise their hands. It's a very unusual symptom. So that's the type of symptom that's of a particular value in homeopathic practice because it's unusual. You don't expect to see it. So that's something I would especially put attention on. Big beads or drops of water only on the upper arm. That to me is the most unusual, most striking symptom in the case. I would also focus on the audible palpitations because that's also unusual. People can have palpitations, but to be actually able to hear them, that's unusual. So those two, to me, are the two most important symptoms in the case. It's not to say that I'm going to disregard the rest of the case, but to me, those are the two most important symptoms. Does that seem reasonable to you, Monica?
It does. Yes, yes. It's very
Okay.
interesting. Yeah. Hmm.
Okay. So let's go ahead and look at the follow-up of the case. All right. So here's the eruptions, and here's a repertorization that I did. And you can see I chose ailments from excitement, the enlarged liver, the accelerated respiration, the complaints in the heart. I underlined the following symptom because I thought it was particularly important, which was complaints of the heart with liver symptoms. And the reason that to me that's a very important symptom is that that's the most critical issue in this case is her heart condition and her enlarged liver. If nothing else gets addressed, I got to address that because these are the things that are actually critical to her life. I mean, these are life-threatening types of conditions. Her aunt, for example, died from this similar type of a situation. So to me, that's a very, very important. If I can find a remedy that has a strong affinity for the heart and the liver, that's going to be great. I included the audible palpitations of the heart, the violent palpitations, the coldness of the feet, the perspiration on the forearms, that perspiration which we say is so unusual, the sleeplessness in the evening, the scratching of the eruptions, the aggravation from the scratching, the fact that the eruptions were worse in the winter, and exercise aggravates. And you can see that the remedy that appears number one from these rubrics, these symptoms that I chose in this repertorization, is calcarea. It's the one that covers the most number of symptoms in the case. However, it doesn't have that very, very strange symptom of the perspiration of the upper arms. And calcarea carbonica is what we call a polycrest remedy, which means it's very, very well represented in our literature. So when it's missing from a particular symptom, you have to wonder, maybe it really doesn't have that symptom. In the Organon, which is the book that the founder of homeopathy, Samuel Hahnemann, wrote, which is essentially the guidebook for how to practice homeopathy, in one of the aphorisms, aphorism 164, Hahnemann writes, aphorism 162 through 172 is the section of the Organon where Hahnemann focuses on the fact that we don't have enough remedies to cover all of the patients that we see in practice, and therefore we sometimes have to give a remedy that isn't perfect. And because it's not perfect, it won't completely resolve the case. Some symptoms will go away, some new symptoms will appear. You relook at the case and you give the remedy based on the new symptom picture. And you might have to give a series of remedies in order, in following a particular order to resolve the particular health issue. I hope that's clear for everybody. Anyway, in aphorism 164, Hahnemann writes, a small number of homeopathic symptoms met with in the best selected medicine does no damage to the cure in those cases where these few medicinal symptoms are of an uncommon kind, characteristic that especially distinguish that disease. The cure then ensues without particular ailments. So Hahnemann's saying in this aphorism that when you don't have a remedy that perfectly fits the case, aphorism 162 through 172 is talking about what we do because we don't have enough remedies to cover every particular patient that we see in practice, we sometimes have to give an imperfect remedy. He says when you give this imperfect remedy, you should focus on the strange, rare, peculiar, uncommon symptoms of the case. As I mentioned earlier, the most uncommon symptom for me in this case was the perspiration on the upper arms. In the repertory that I used earlier, there were only two remedies listed, arnica and petroleum. There is another repertory called synthesis, and it also has a rubric, extremities, perspiration, upper limbs. It has a larger number of remedies. And there is an interesting thing here that this rubric has two remedies, arnica and petroleum. This one has a larger number of remedies, but I see also petroleum in here. And here I can see the petroleum is in red, in bold type. In other words, it's an important symptom for the remedy petroleum. So I said, well, let me go and read about petroleum in our literature and see what it says. So I went to the original source book, which we call the book that describes the provings. The provings are when you test the substance on a healthy person to see what symptoms it produces, so we know how to prescribe it in practice. I went and I read, this is about petroleum, cramps in the back of ribs with pearly drops of perspiration on the face and arms. Pearly drops, big beads of drops on the upper arms. That's an exact description of this peculiar symptom. So based on Hahnemann's suggestion in aphorism 164 that I focus on the uncommon symptoms, this creates an issue for me because when I look here, I see that calcarea is not in that particular rubric, even though it covers the other symptoms.
Volume. Yeah.
Calcarea is not in that rubric for upper perspiration in the upper arms.
Oh, yeah. Mm-hmm.
So following Hahnemann's suggestion, I decided to give one dose of petroleum 30C to see what would happen. Okay, I'm following the uncommon symptom in the case, the perspiration in the upper arms, petroleum is there. And also the other thing about petroleum, okay, is that petroleum is a remedy that is well known for skin problems that are worse in the winter, which is exactly what she had, skin problems that are worse in the wintertime. So that fits as well. Now, it didn't seem to fit the totality of the case perfectly, which is why I gave a kind of a lower potency. I wanted just to test it to see what would happen. So I gave one dose of 30C. There was no improvement of the chief complaint. The palpitations did not get affected. The liver enlargement or the skin issues, nothing was affected whatsoever. There was only one change in the case. The perspiration on the upper arm was gone, and she was now perspiring on the scalp, especially during sleep. This is a keynote. A keynote is a very well-known symptom of a particular remedy. This is a keynote of the remedy Calcarea carbonica. So I decided now to give Calcarea carbonica 6C TID 3 times a day, succussing 7 times between each dose. In other words, I put it in solution, 6C potency, and I was succussing 7 times between each dose, 3 times a day. Okay, here you can see that when you remove the perspiration on the upper arms, and now you add at the very bottom there head perspiration during sleep, which is a well-known symptom, well-known keynote of Calcarea carbonica. Now Calcarea covers all of the symptoms of the case. And this is exactly what Hahnemann says in the Organon. He says if you give a remedy to which the individual is sensitive, but it's not exactly the right remedy, what will happen is that the life force of the person will generate the symptoms telling you what remedy the person really needs. That's exactly what happened here. I gave petroleum, the perspiration on the upper arms went away, and now the life force says, no, it wasn't petroleum. You need to give Calcarea. And the reason is you can see that there's the perspiration on the scalp during sleep. So I gave her the little girl Calcarea 6C 3 times a day. Here you can see in aphorism 167, Hahnemann describing this process. It's not just for acute disease, it's for all disease. He says, if accessory ailments of some moment arise, if new symptoms arise with the use of the first employed, in this case, petroleum, in perfectly homeopathic medicine, one should not let this first dose fully finish its work, abandoning the patient to the medicine's full duration of action. Rather, one should examine anew the now altered disease state. In other words, what symptoms went away, what new symptoms came up, and bring the original symptoms, the ones that are still there, that remain, into connection with the newly arisen ones in order to record a new disease image. That's what we did. We took away the perspiration on the upper arms, we had the perspiration on the scalp at night, and it clearly pointed to Calcarea carbonica. Second follow-up was 6 weeks after the first intake. There was significant improvement in the mental state and energy level, but there was no change in any of the physical complaints. Monica, what would you do here? What do you think?
Well, maybe change the potency and try again.
Okay. I mean, do you see that? Do you see this as a positive sign?
I'm sorry?
Do you see this as positive? What's happening?
Well, there's no change in physical symptoms, but there is significant improvement in mental state and energy. And so that may be that the vital force is starting to work.
Very good. Excellent. And that's exactly what this is, a positive response. Hahnemann describes this in aphorism 253. He says, in all diseases, especially rapidly rising acute ones, the patient's emotional state and entire behavior are the surest and most enlightening of the signs showing a small beginning, not visible to everyone, of amelioration or aggravation. When there is an ever so slight beginning of improvement, the patient will demonstrate a greater degree of comfort, increasing composure, freedom of spirit, increased courage, a kind of returning naturalness. So when you see any improvement at all, that's a good sign. The mental and emotional state, the energy of the level of the patient will improve before the physical symptoms will get better, especially in more chronic types of conditions. In acute conditions, you may see much more rapid improvement of everything. But in the chronic situations, this is very, very common. Mm-hmm. The third follow-up, this is now 10 weeks after the first intake, the energy level and mood are worsening, still no change in the physical symptoms or chief complaints. So I've given this Calcarea carbonica. Initially, the child seems to be getting better, but then at a certain point, the improvement stops. Mm-hmm. In a situation like this, because the Calcarea did work before, you would increase the potency. So I decided to go from 6C up to 12C. Now, there are number of possibilities here. There are a couple of possibilities here. There's a possibility that it could be an antidote, but I couldn't find anything. She's a student of mine, the mother, and there was nothing in there. Um, Perhaps the disease needs a higher potency due to its aggressive nature, which is why I'm going from the 6C to the 12C. Bruce, I'm teaching a class. Um, so perhaps this is a higher potency due to its aggressive, which is the case. So I went from 6C to 12C. I hope that makes sense to everybody. Okay, succussing again 7 times between each dose. And again, with aggressive disease, sometimes the practitioner needs to be aggressive with their dosing because the disease is so aggressive, it just uses up the energy of the remedies very, very rapidly. The fourth follow-up is now 13 weeks after the first intake. And here the energy level mood continued to worsen. Still no change in physical symptoms or chief complaints. In my experience, if you go up in the potency and you see no improvement, that's not a good sign. There could be an antidote, but I didn't think that was the situation. It could be that she's not curable. That's an incurable case. That sometimes happens. I was really at a loss what to do here. But I thought to myself, what really needs to be addressed here? What really needs to be dealt with? And what really needs to be dealt with is the heart and the liver. In aphorism 3 of the Organon, Hahnemann writes that to be a genuine practitioner of the medical art, a physician must clearly realize what is to be cured in diseases, that is, in each single case of disease. And to me, what really needed to be cured for this little girl was her cardiovascular issues and her liver issues. Those were the most important. So I thought to myself, what remedy, if I just go open up any Materia Medica book that describes our homeopathic remedies, what remedy, when I start to read about it, the first thing it's going to say is that this is a remedy that affects the heart and the liver. Monica, do you know what remedies that might be? You have any thoughts about that?
I'm not sure, honestly.
Okay. Well, there is. Okay. Again, what really needs to be addressed here is the liver and the heart. And the remedy I decided to give was digitalis.
Oh, yeah. All right.
Yes, which actually shows up number 3 in this repertorization chart. It doesn't cover the skin issues, but it does cover the liver and heart issues quite well. So I decided to give 1 dose of digitalis 30C just to see what would happen. Here's digitalis. It's a great heart remedy that you use when the pulse is very, very slow in the early stages or very fast and irregular in the later stages. And it's particularly indicated for when there's a combination of liver and heart problems together. So I gave the remedy, and the 5th follow-up was 15 weeks after the first intake. There was no change, except there is now 1 new symptom. Now C wants to get up in the middle of the night from around midnight to maybe about 3 a.m., and she wants to go out and play in the playground. She's not feeling bad. She's not feeling sick. She just wants to get up in the middle of the night. No other change. But as soon as I hear this, I know immediately what remedy to give. And the reason I know what remedy to give is because there's a rubric in the repertory about playing. And there's only 3 remedies in that rubric: desires to play at night, cypripedium, cola, and metarhinum. Now, metarhinum is a remedy that we think of for genetic or congenital disorders, especially in infants and babies. And it's also a remedy that has a very strong affinity for cardiovascular issues. There's another good reason to think about metarhinum, which is that in the repertory, there's a rubric, one of those symptoms, called general's reaction, lack of reaction. And this is a rubric that you think about when the well-selected remedy, the one that covers the most number of symptoms and seems to fit the best, when the well-selected remedy stops working or doesn't work. You can think about these remedies in those types of circumstances. To me, calcarea carbonica covered the case really well, covered the totality of the characteristic symptoms, and it should have worked. Well, it started to work, but then it stopped working. Okay. When that happens, you can look to this rubric. These are remedies when there's a lack of reaction, when the well-selected remedy doesn't work, or stops working. One of the things that you'll notice about this rubric is that there are remedies like metarhinum and serinum and tuberculinum and carcinosin and syphilinum. What kind of remedies are those, Monica? Metarhinum, carcinosin, syphilinum, tuberculinum.
So it's right.
They're all nosodes.
Hmm?
And actually, it's well known that nosodes have this ability to unblock a case when the well-selected remedy doesn't work or stops working. So for all of those reasons, it's in this rubric for wanting to play at night. It's an important remedy for genetic or congenital issues. It's got a very strong affinity for the heart, and it's in bold type in this rubric for lack of reaction. And the nosodes in general are known to be a group of remedies which work in this way. So I gave 1 dose of metarhinum 30C, and the 6th follow-up was now 18 weeks after the first intake, and there's now dramatic improvement of all the symptoms. Mood and energy are significantly improved. The palpitations about 60% improved. The liver has decreased in size, and the skin eruptions are about 90% better. Here you can see, look at the skin now.
Wow.
Okay?
Yeah.
All right. So I'm going to stop there. There's more to say about this case, but we're running short on time. I have a patient in just a little bit. But I will, we've got about 9 minutes. I would be happy to address any questions that anybody has about this case or the other case, or really any aspect of homeopathic practice that you're interested in finding out more about.
That's great. I could ask you questions if that's okay. I mean, I think that what was beautiful about the case, the second case you presented, was that persistence. You don't give up after not finding the first or second, after the first or second remedy doesn't work. It's sort of a detective work, and the body will show us, right, the new symptoms if they are something necessary to take into consideration. So I think that that's a wonderful learning from that persistence.
Yeah, I mean, a lot of times people think, you come to homeopathy, you just take this one pill and that's it. You are well for the rest of your life, and you live to like 150, and you probably become, enlightened as well. And that's not really the truth of homeopathy. Truth of homeopathy is that it's a process. And depending on how sick you are, it can take a period of time. I mean, especially if you've got serious chronic disease and you've taken a lot of conventional medicines for a long period of time, it could take 2 or 3 years to bring that person back to a good state of health. With acutes, obviously, it happens much more rapidly. You could have a child come in with an otitis media, a middle ear infection. You give them a remedy. 10 seconds later, they're on the floor sleeping. The mother carries the sleeping child home, and when the child wakes up 2 hours later, the child is asymptomatic. So you can see anything from like that all the way to taking it 3 or 4 or 5 years, even depending on how much suppression and how much pathology there's been.
Mm-hmm. There's actually a question coming up, and do you know what happened with the girl, if she actually remained healthy?
So, okay, I wasn't going to share this with you, but I will go ahead and share it. So I will go ahead and share you can still see my screen?
Yeah.
Okay, so I'm going to go ahead and I will share that. Okay, so hold on 1 second.
Okay.
Hold on.
For those who are not watching, we're just waiting for Dr. Elia to find the slide. Yeah.
Okay, can you see my slides now?
Mm-hmm. Yes, we do.
Okay. All right. So I'm going to go and I'll show you what happens. Okay. So unfortunately, this case has a sad ending, but it also provides for a very important lesson. So during this time, I was teaching in Japan, but I was also teaching quite a bit all over the world, in Europe, and I was training people in Japan to be able to practice homeopathy. But we were still very early in the development of the educational program in that country. So the people who were supervising my patients weren't fully trained yet, and I had a medical doctor who was supervising my patients. And what happened is the child developed a very high fever. The woman who was attending my patients gave a number of remedies which were probably not well prescribed. The child's fever got very, very high. The parents got afraid. They got very concerned. They took the child to the hospital. The hospital administered antibiotics. The child had a gram-negative septicemia. She reacted to the antibiotics and she died in the hospital. And I had arrived in Japan shortly after this happened, and the owner of the school told me that this child who had been well for like 9 months had passed on. I was like shocked. I couldn't believe it because she was so well. And basically what happened is that, what's unbelievable is when they did the autopsy on the child, there was no internal pathology. The liver was normal and the heart was normal. Those remedies that we had administered had completely resolved the case. But there's an important lesson in all this, which is talked about in a book written by George Vitulkas called Levels of Health. It's the most recent book that he wrote. And I'm going to go ahead and read this, and I'll explain what he's talking about. In this book, he divides people into 4 levels of health: A, B, C, and D. C and D being the worst level. And then he divides each of those 4 levels into 3 subcategories. So there's a total of 12 different possibilities. And he says, now this child would definitely be in a level C or D. She was in very, very poor health. And he writes, the longer it takes for an organism in group C to develop an acute disease. You see, when you're very sick, you can't develop an acute disease. When, like, a schizophrenic will rarely produce an acute disease because they're too sick to get an acute disease. If they do get an acute, if it doesn't kill them, while they have the acute, their schizophrenic symptoms go away. If they recover from the acute, the schizophrenic symptoms return. So when you get healthier, you have more of an ability to produce acutes. That's why children produce such strong acutes with such high fevers, because their immune systems are stronger, and that high fever and that strong response is an indication of a strong immune system. So as the person gets better through homeopathic treatment, they can begin to produce acutes because they're getting healthier. So he writes, the longer it takes for an organism in group C to develop an acute disease, the more severe the chronic condition is. The immune system is not working adequately in this group. These patients are prone to developing serious acute diseases that must be treated. That's what happened. In group C, it is usually necessary to administer several remedies in the right order before the organism can produce an acute disease. Treatment may take several years, especially if the case belongs to the lowest levels of group C. When the ensuing acute occurs, it is very severe, like it wasn't for this girl, and it will definitely need treatment. Sequential remedies may be required. Most mistakes are made at this state because the acute is severe and dangerous, and the homeopath becomes frustrated. In an effort to relieve the condition, the homeopath does not wait for a clear picture, symptom pattern of the acute remedy to arise, and instead gives the wrong remedies. That's what happened. Eventually, the correct remedy, well, there was no eventually correct remedy. They took her to the hospital. Eventually, the correct remedy is found and eventually eradicates the acute, but the previous incorrect remedies may cause a partial relapse of the chronic state. In the course of these severe acutes, the patient and the homeopath often resort to conventional treatment, such as antibiotics. That's what happened, hoping to control the episode. In most cases such as this, a full relapse of the chronic condition occurs. Repeating the same chronic remedy will often do the trick, but not always. And to add insult to injury, the interference of antibiotics or anti-inflammatory drugs can change the pattern of symptoms, and another remedy may be indicated. So, unfortunately, if she had been given the right remedy for that acute fever, as Vitulkas describes here, she would have been better and it would have been fine and she would have been well. Or if they had simply just let the fever go without giving the antibiotics, she probably would have recovered from the fever as well. Probably. We don't know for sure. But unfortunately, she was taken to the hospital. She was given antibiotics. And because she had this gram-negative septicemia, she reacted very intensely and ended up passing on.
Mm-hmm.
So it's unfortunate, but there is a very useful lesson for the homeopathic practitioner in here in terms of knowing what to do when they're treating very serious chronic disease. And here you can see that there's a relationship between the chronic state of the patient and the ability to produce acutes. These things are actually related to each other.
Mm-hmm. Yeah, and thank you for sharing that. It's a very sad ending on the one hand, but on the other hand, also it tells us that homeopathy is a wonderful, incredible healing art, but of course it doesn't make people perfect. So we cannot expect by taking a few pills to actually cure everything and then be completely invulnerable to any assaults from diseases. So we can be realistic, but also let's share those amazing cures too, like you did today. So, all right. Well, good. Well, thank you so much. This was very educational. Thank you for putting me on the spot.
Yeah, I had to do it.
I love that.
You did great. You did great.
Just starting to learn. So beautiful. Well, thank you so much, Dr. Elia. I know you have a super busy schedule, but I deeply appreciate your time today. And I
Thank you,
appreciate
Monica.
everybody.
Thank you for inviting me. Yeah. You have a very
Absolutely.
bye, everyone.
Bye, everybody. Have a wonderful day, and we appreciate it all. Thanks for joining in. Bye bye.
Bye bye.